Hello and welcome back to another episode of DC3 Health Talk. I am your host, Brian Mook, and this is the show where we focus on your mental health, your emotional health, and your physical health. We give you tips and tricks. And today I have a special guest with me. She's called Emma Nguli, and she's a student counselor at Daystar University. She can introduce herself and talk about briefly what she does before we get into our topic for today. So thank you. Thank you for coming. Welcome.
Thank you, Brian, for having me. I'm excited to be here and to raise awareness about mental health. I think it's very important at such a time as this we talk about it. So, as you heard, my name is Emma, and I work at Daystar University under the Student Affairs Department in the counseling section. And I'm excited. And we are always available for you, so please make a point of visiting us. So, yeah, Brian, thank you. I'm excited.
Thank you.
Yes.
So today we are talking about PTSD, and some people maybe have heard about PTSD, but they don't know the facts. So today we are going to dive a little bit deeper into it. So, what is PTSD in short?
Well, we first, so because it's an acronym, so let's break it down. So it is post-traumatic stress disorder. So from English, post means it happens about after something.
Uh-huh.
So in this case, it is a mental disorder that actually is triggered by experiencing or witnessing or going through a traumatic experience or a traumatic event. So it's a mental disorder actually, the word PTSD. I know a lot of us use the term, PTSD, but it has to actually have, it's either you witness it yourself, you witness it happening, or you experience it. Okay. You as an individual, you go through it. It can either be you go through an accident, or you go through what? Through any traumatizing event, or you witness, you see, like you're on the road, you see an accident happen. It hasn't happened to you, but you've seen it. The other thing is hearing stories about it. So like you hear someone has gotten an accident, and someone that you knew. So that can also cause trauma. It's actually called secondary traumatization. Okay. Then the other one is actually you continuously experience, like you see people like police officers or nurses right now in this COVID-19 period, they're on the front line, right? Yes. So they actually witness a lot of patients coming in with this COVID-19. They witness death. So for them, it's very easy to get post-traumatic stress disorder.
Okay, so maybe just a follow-up question on what you just explained.
Yes.
You've mentioned that some people can experience it on a secondary level. So is there a limit or a measure to the intensity of somebody who has gone through the experience and somebody who has just simply witnessed it? Do they experience the PTSD on the same level, or one is slightly higher?
Okay. Let me first give a disclaimer. It doesn't mean that anytime you go through a traumatic experience that the end result is post-traumatic stress disorder. This is something that may happen. It can develop too. Okay. So, and we can't say the fact that someone has witnessed and the fact that someone has experienced, one is highly more exposed than another, because you see these symptoms, individual experience them differently. So it might just happen that the person who actually witnessed and the one who experienced doesn't get, but the one who witnessed it happen actually gets it, or the other way around. So I wouldn't say it's more prevalent among people who actually go through it firsthand. It can be either, because the symptoms are what categorize someone to actually get it. So it could be either way.
Okay.
Because you see, at the end of the day, they're both exposed, just at a different level.
Okay.
Yeah.
And so you've touched on the symptoms. So let's dive into that. What are the symptoms of PTSD? How can somebody know that, okay, I might be experiencing PTSD and go and actually get help now?
Well, there are several symptoms, but just before I dive into the symptoms, I want to clarify something. I earlier had just stated that the fact that you are exposed to a traumatic event doesn't necessarily mean that you will develop PTSD. You might or might not. And by the time you actually are diagnosed to have PTSD,
Yeah.
These symptoms that we're just about to discuss, you have to have them for a period of 1 month and above. Anything below that, we can't call it PTSD.
Mm-hmm.
We can actually call it the acute stress disorder, which
Okay.
happens immediately after a traumatic event. But when you talk about PTSD, it has to be a month end.
Okay. So
Sawa
the
sawa.
difference between PTSD and acute stress disorder is the time frame.
Of course, the onset and the time frame for diagnosis, in that the acute stress disorder can happen immediately after exposure to a traumatic event. It can be like 3 days to a month. So you experience those symptoms, which are similar to what I'm just about to talk about. The symptoms for PTSD and the symptoms for acute stress disorder are very, very similar.
Okay.
So it's not that they have a very huge difference as such. So that's it, the onset and the time. So acute stress disorder, 3 days to 1 month. PTSD has to be anything above 1 month.
Okay.
Yeah. So I think we can dive into the symptoms. Then
Yes.
we can talk about probably very slightly more differences between the PTSD and the acute stress disorder. So these symptoms are packed into various categories. We have symptoms that we call intrusive
Okay.
symptoms.
Inclusive.
Intrusive,
Mm-hmm.
like they intrude. So
Yes.
these are symptoms that you keep on like experiencing. It's like having memories about the traumatic event. So
Mm.
it keeps on coming back again. So that it means it's intrusive. It's like you're remembering, you're having serious memories
Yeah.
about the traumatic event.
Okay.
The other thing is avoidance symptoms. They're under clusters. So avoidance symptoms,
Mm-hmm.
where a person tends to avoid either the place where the traumatic event happened, avoids the people, avoids the route, avoids any talk about it. You find that someone actually doesn't talk about what happened. So that is what we call the
The avoidance.
avoidance. Yes.
On
Then you also have,
avoidance, sorry, before you continue, on avoidance, can
yes,
we, let's say something, the traumatic experience happened in an environment where that
yeah.
person cannot completely rule out. So let's say maybe it's a car accident, and then
Mm.
um, this person still has to travel by road to go to from place A to place B. So how does how do they cope with them? Or maybe we'll go into that when we were talking about the treatment methods.
You see, no, I can just answer that because you'd find in such an instance, then someone is not able to cope at all. You find it's interfering with their daily function. If they have to use, there is a road accident, probably, let's say this person is actually driving the car. So you find that this person, either they don't drive at all, they have to be carried, or when they're carried, you find they sit at the back of the seat kabisa because they have to. So it really interferes, or you find they prefer to walk.
Mm.
Or when they get into the car, you start noticing they start experiencing some panic attacks. They are not able to breathe. They have chest constrictions. They are sweating and
Okay.
things like that, because that brings the anxiety that it once brought
Okay.
when they experience a traumatic event. So it can be part of the diagnosis. The fact that the person is not able to cope, the
Okay.
daily functioning of this person has been interfered with.
So
Yeah, so yeah, avoidance is you avoid the places, you avoid peoples, you avoid thoughts, you avoid emotions that are related to that traumatic. So it's like you block, totally block.
mhm.
I think I can just share a personal experience I had when I was, I think, around 12 years old. We had a home robbery. So you were home with my sister and my mom. My dad hadn't gotten home yet. So my mom was actually leaving to go for a church function. It was around 6 p.m. So when she's pulling out of the parking, we notice some noise, and then we have 7 men in the house. We're like, what just happened? So they disrupted a lot of things. And I remember my sister and I were forced to sit down at a certain corner. And they were like, hey, today we are going to kill someone. So this guy who's saying today we are killing someone is pointing a gun at my face.
Yeah.
So his guy actually, prepares the gun and actually cocks the gun ready to shoot. I'm like, oh God, actually I'm dying. So I remember saying, my last friend, I was like, okay, fine, God, I'm ready. At 12 years old. So that happened anyway. They didn't do any harm. They left. So it was until my undergraduate classes at Daystar when I was doing psychology that I discovered, oh my goodness, mine was not PTSD, but I was traumatized.
Mm.
So I couldn't, for a very long time, I couldn't get into a car. The reason is my mom was actually attacked at the point of driving out. So my mind connected driving. That time we used to live in South B.
Yeah.
So anywhere around South B, I couldn't. I just couldn't do it. And I remember I was very easily startled. So someone comes behind my back, I'm like, "Ah, yeah, what's that?"
Mm.
Any sound like the sound of a gun, I used to very easily. So for a very long time, there's a particular route where they we used to be that I avoided for the very long time. At the long run, we had to move out because all of us were really, really traumatized about that. So you can see I did go through some of those symptoms, but mine I did not get to the criteria of diagnosis
Okay.
for PTSD. So just before I continue the symptoms, just before I forget, is that you can be traumatized, but it doesn't mean you get PTSD. I was traumatized, but I
Okay.
didn't get PTSD.
So sorry
Yeah.
about that. And how, like, maybe if you can share
Yeah.
how you got over the trauma without getting into PTSD and going to seek professional help. How did you cope with that by yourself? Cope with that by yourself.
At, I think at that age, at 12 years old, we talked about it as a family.
Hmm.
And my dad really asked us a lot of questions. How are you feeling? He kept on checking on us. How are you doing? So there was constant checking up, and we were able to tell and retell and retell the story time and time again. So with time, it stopped being so scary to think about. So it wasn't as bad because there was that environment of us going through it together as a family. And but that was not the only time they came. They came two other times, but the two times they didn't get into the house. So it was a bit sometimes you get to a point where you are a bit numb. It's one of the symptoms of PTSD.
Yeah.
I am still saying I didn't get there. But you get a bit numb so that you don't feel anything as such. So I think for quite some time, I didn't realize that that was what had happened to me until I sat into a class and we were talking about this. I was like, ah, yeah. So I remember actually sharing it in class. And as part of psychology major students, you have to go to personal therapy. So I
Okay.
talked about it. So that it didn't develop into full blown because I didn't have all the symptoms. I was just hyper vigilant. I was a bit numb. I was avoiding a few things, but I talked about it. Talked
Okay.
about it with family. Talked about it with people who came to comfort us, and I was made to understand a few things. But I went to therapy much later when
Okay.
I was in undergrad, and that's how I was able to now come to terms and relate. Oh, so this is what I went through.
Okay.
Yeah, so that's what I can share.
All right.
So back to the symptoms
Yes.
before we forget. So I had talked about the intrusive, just to go back, and this is where you have memories.
Mm-hmm.
You also have dreams. Some people have nightmares. They wake up at night and they dreamt like it has happened again. The other thing would be things like flashbacks. And this is where you actually experience, it's like you're not asleep, but
Mm-hmm.
it's like you're seeing the event happen all over again. It's like you're sitting somewhere, but it's like you're not there. You're like seeing that event happen again. So
Okay.
that is part of the intrusive symptoms. And yeah, I think that's it. And they also bring out those symptoms, the dreams, the memories, the flashbacks. You
Yes.
feel like you're actually experiencing. Someone can actually feel the pain if there was pain. Someone can actually feel the anxiety if they experienced it. So that's one. Then the other thing I talked about is avoidance symptoms, and this is where people avoid either the places,
Mm-hmm.
people avoid the people who were there during that time. They also avoid the thoughts in that they don't want to think about what happened at all. So
Yes.
and you find a lot of people who've been traumatized, they tell you they have a lot of blank spaces. there's a lot about trauma and the memory, what it does to memory.
Yes.
So someone who's been traumatized, you find that they'll tell you, I can't remember. I can't remember. So there are a lot of gaps. You've had even people who've been sexually abused and they're going to court. They're asked, so what happened? And they're like, I can't remember. You see, so someone is wondering, so you can't remember and you want to enter evidence. What
Yeah.
does that mean? But it's just that there's a lot of impact on memory as far as trauma is concerned. There's it's a lot. I don't want to talk about it. It's a whole jargon, but
Yes.
there's a lot of effect on what trauma does to the mind. So when someone tells you they can't remember, sometimes it has blocked the memory kabisa. So
And do you think that is a way, a defense mechanism of the mind to keep the person away from the pain?
okay, there's a biological effect in that actually trauma has on memory, in
Okay.
that there's some alterations in the neurotransmitters in the mind, in the brain,
Yes.
that are changed when someone experiences trauma. And even when you look at some of the images, I wish I had them here, but send you some of the images of someone who has PTSD, the brain images of someone who has PTSD, and someone who has a normal, who's not gone through any traumatic exposure. You'll see the images a bit different. Now, I'm not a doctor, so I will not get into much, but
Okay.
I just looked into that a while back, and I realized there's actually a huge difference. So,
Okay.
and sometimes it can actually be a psychological effect, and that's where avoidance comes in. So they block,
Okay.
they block the memory, and it's not conscious. So like, oh, I decide today, I'm not thinking about it. It's not
That's not.
conscious. You just find that when you try to pass somewhere, you just can't pass.
Okay.
So it's something that happens unconsciously because of what the trauma has done to you. Then you have other groups of symptoms called the hyperarousal symptoms,
Mhm.
and this is where you have difficulty in falling asleep or staying asleep.
Okay.
So that is one. So you're also always having trouble with sleep. Then there is hypervigilance. I told you about that. You're easily startled. You're always on the alert, checking, okay, who's around. I usually imagine, I hear stories of people who have gone through um, terrorist attack. I think I once had a not one on one. I had a recount of someone who was in one of those places,
Okay.
and the first thing they do when they get into the supermarket, they check, okay, so which is the exit point. So they're always hyper alert to check what
And
is going to happen, who's around me.
what's the difference? What's the main difference between hypervigilance and anxiety?
Well, you see, our anxiety is just more than hypervigilance.
Okay.
Anxiety has a lot more. There's because hypervigilance, you're just alert.
Okay.
You're easily startled. So those hypervigilance could be some of the symptoms of anxiety.
Okay.
They could fall under anxiety.
All right. Oh, I understand.
Yeah, yeah. So there's that hypervigilance where you're easily startled. Sometimes you have outbursts, emotional outbursts or anger outbursts at people or things. You have there's difficulty in concentration, and there's also sometimes we call it feeling on the edge. You're always on the edge. You're not
Yes.
settled.
Okay.
Then the other group of symptoms is a negative mood, whereby you actually have you're always very sad, or you've blocked the feeling, or you've lost interest in things that used to interest you, or you actually don't feel anything anymore. You're just numb.
Okay.
So things happen, and you're just things that should actually make you feel sad. You're just like that.
Uh,
So yeah. But then again, before diagnosis, there are many more in the DSM-5 that I won't talk about it right now
all right.
because there are several. But at least you have to meet, out of the key symptoms, you have to meet at least one or more,
Mhm.
and they have to be in existence for a period of more than 1 month.
Okay.
Yeah.
Thank you very much for coming to DC3 Health Talk. And don't go anywhere. Subscribe to our YouTube channel and turn on that notification bell so that you don't get passed by when we upload these videos. Stay tuned for part 2 of the PTSD talk, which is coming right after this. Don't go anywhere.